OET letter, okay, a B grade OET letter. So here they are, 5 tenses. Now, these are not by any means the only tenses that you will need to use, but they are the most important foundational ones. So you absolutely need to be able to use these correctly in context. So let's start with the present simple. Okay, let's put an example up. Mr. Lin urgently requires your expert assistance. So don't forget, with the present simple, third person singular, you need to add the S, he, she, or it. Okay, so that's a change on third person singular. When do we use it? We use it for conveying factual information, facts, general truths, what else? Routine actions, okay? Things which are done on a routine basis. So habits, I guess. And there's also a group of verbs called stative verbs. And these are a group of verbs that basically express a state, like understand, require, need. And these are generally used always in the simple form. For example, we would never say, I am needing your assistance. It would always be, I need your assistance, even though it is in the present moment. Yeah, that group of verbs, it's worth looking them up. They're usually always expressed in a simple form. Right, something's gone into my chat box. No, okay, Anna's asking, no, the S only goes on the third person singular, okay? So, I require, you require, he or she requires. And then plural, you require, we require, they require. So the only person it goes on to is the third person singular, he, she, or it, okay? Well, that's where you add the S, and that's in the present simple tense. Okay, so then we look at present continuous. So that's made up of 2 parts. So Miss Adams is currently receiving. So you've got the present tense of the verb to be plus the main verb in the ing form. So is receiving, I am receiving, you are receiving, Miss Adams is receiving, okay, etc. So when do we use it? We use it for actions which are ongoing, ongoing at the time of either speaking or writing. So they are in process, okay? They are unfinished actions. So that's when we use the present continuous. For present perfect, that has 2 parts, and it's conjugated with the present tense of the verb to have plus the past participle. So I have done, you have done, don't forget she or he has done, okay? We're still going to change that helping verb because it's in the present simple, followed by the main verb in the past participle. So Miss Smith has been treated with cold compression therapy. That's basically a present perfect passive, and that particular use is for a completed action in the past when there is no specific time reference and the time is actually not important. We're focusing on the fact that the action has been completed. So for example, I have visited Egypt. I'm not saying when, I'm just saying that in the past sometime I have visited Egypt. So it's a completed action, but no time reference given. The other use of present perfect is with the words for and since. Okay, so this is a different use when you're talking about an action that begins in the past and continues up to the present moment. So for example, I have been a teacher for many years. I have been a teacher since, and then we'll leave that date blank because I'm very, very old, okay? So yeah, basically for and since is for another type of use of present perfect. And then we have present perfect continuous. So similar time aspect, but the idea is to also convey the idea that it is ongoing. So for example, Mrs. Chan has been undertaking a course of, or has been undertaking, a course of physiotherapy sessions, for example. And indeed they are ongoing, okay? She has more to go, as it were. So that is, that has 3 parts. That is basically the present tense of the verb to have plus been, and then the ing verb of the main verb, the main idea that you want to convey. The last one, past simple, okay. Mr. Jones was admitted to St. Andrews 2 weeks after his operation. So past simple is used when there's any time reference. So if you're talking about the patient presenting on a perfect date, on a particular date, excuse me, you know, on the 6th of June, Mr. Jones presented with the following symptoms. So that's past finished with a specific time reference would be past simple. Right. So I've got a couple of comments going into my chat box. Okay, so I've got a question here from Anna. Basically, I could do a whole lesson on the present perfect because it has several different uses. But the two most common ones, Anna, are the two I've described. So you could either say the patient has had these symptoms for 2 weeks. That means they began 2 weeks ago and continued up till now. So with for and since, starting in the past, continuing up till now. That's one use with for and since. The other use is the patient has been hospitalized twice. We're not specifying when, we're just conveying the idea that on 2 separate occasions it has happened. So that's another use of the present perfect. Okay. Lay, if you're talking about changes regarding the writing subtest, a few days ago, I am unaware of those. I don't know where you saw that. If you could specify what they are, please, I'd be happy to comment on that. Yeah. Okay, so moving on, we're going to give you a quick quiz. If you feel that you're a bit shaky on, you know, a couple of tenses, the place to go is to our sister website, which is www.e2school.com. That is a place where you can basically do some independent study on language areas, vocab, speaking, and grammar review. So I highly recommend going and checking out those resources if you feel you need to patch up some of your knowledge on your when to apply the tenses, okay, and how to use them. So that is something that you can do some follow-up study with. But yeah, I need to just do a quick quiz now, just to let you test your knowledge on your tenses. So I'll pop out while you do that. Okay, so let's go through the answers together. I'm going to put them up on the screen and you can check your answers and see if any questions arise. So number 1, when a post-operative dressing is no longer serving its purpose or is falling off, a new dressing must be applied immediately. So that is using a passive form with a modal verb. And in this case, we're using the modal verb must, which conveys a strong obligation, a very strong obligation. So an active would you must apply the dressing, or the dressing must be applied would be the passive form of that, okay? So that's basically using it with a modal verb. Then we have number 2. There should be no argument over the number of times a patient who requires a full course of tetanus vaccine must be vaccinated. So here we're talking about, we're using the present simple because we're talking about a generality, okay, something that is generally true. A patient who requires a full course of tetanus vaccine, basically, this is something which is a general truth, like a habitual thing. So we would use the present simple for that. Number 3, Mrs. Brown needs to restore power to those muscles affected by the inflammation, but our priority is to get her posture and alignment right first. So you need to know about modal verbs, guys. So after must, okay, there is no to. So when we're using an active form, you would say you must attend the clinic. But if we're going to use need, you need to attend the clinic. So after need, we use the infinitive with to. So these are details that you need to know how to use these different modal verbs. They're very useful, especially when expressing obligation. Then we have number 4, on the rare occasions I take penicillin, I come out in terrible hives, but I don't have any other allergies. So this is again habitual actions. So we're using the present simple here because it's on the rare occasions. So think of adverbs of frequency: always, never, rarely, sometimes, occasionally, on the rare occasions. That's talking about the frequency of an action, and that's when we use the present simple. So just a little bit of a review there. Like I said, if you need to do follow-up, please do go to the E2 School website, and they have some great resources on there if you want to review your tenses. So getting on to the writing test itself now. The writing test requires you to do the following. First thing you need to do when you get the set of case notes under test situation is you need to go down to the bottom and you need to read and analyze the task. That will establish purpose, and basically you need to start from that point. Very important. Second, then you're going to read and analyze the case notes. And then thirdly, you're going to get into the writing of the referral, discharge, or transfer letter. So just to be clear, these 3 types of letter that you need to write, the process, the approach is the same, okay? It will be clear from the case notes and the information presented what type of letter it is, but in terms of the step-by-step we're going through, you're going to approach each one in the same way. In other words, go to the task first, then read and analyze the case notes, then do your selection, and then proceed with writing. So let's break that down a little bit further. So for the first 5 minutes, okay, when you get your case notes, you will not be allowed to write anything. And the reason for that is because there's a lot of information that you need to absorb, and you need to absorb it, you know, accurately and carefully, in order to make sure that everything follows on in terms of the correct selection and how you basically determine what the purpose of the letter is. So that's why you can't write anything for the first 5 minutes. So you need to go to the task, read it carefully, who am I writing to, and what action do I want this person to take, okay? Because you are the person writing the letter. Then number 2, you need to read the case notes, and you need to understand the key facts about the patient's condition for which you are referring, discharging, or transferring them, okay? So what is the main medical situation going on with this particular patient? So get the key facts connected to that. The case notes come subdivided with headings and subheadings. So that is useful because although it's a lot of information coming at you, it is subdivided into chunks of information. So it has been logically organized for you. Then you need to think about, as you're going through the case notes, based on who you're writing to, what action you want them to take, and what the situation is with your patient, you know, what is the issue with this patient. On the basis of those things, you are going to then go through and identify what is relevant, what needs to be included in your letter, and what clearly needs to be left out, because you don't want to be wasting your reader's time with irrelevant material, okay? So, and then within that, you'll kind of make a mental note of what you might prioritize as well. So you're thinking, yes, this is all relevant, but you might add, you know, you might sort of ascribe more importance to certain bits of information than others and start sort of ranking it in terms of how important it is. After the first 5 minutes, then you can start writing. So at this point, you can start kind of annotating your case notes. You've made a mental note of what you're going to include. You might want to start making some notes about what you will include and what's going to go into a paragraph together. So you're thinking about paragraphing, which will be 3 to 5 short paragraphs. Why do we use paragraphs? Well, it basically makes it much easier for the person receiving the letter to process the information if they're getting it in chunks. So make sure there is a clear theme for each paragraph, and then you can start sort of ascribing certain bits of information to certain paragraphs. So you can say these case notes taken from these subsections, that would make sense to put those together in that paragraph, etc., etc. So you need to do that before you even think about writing. So it is part of the criteria to show that you are able to paragraph logically. So you need to be able to have a very clear single theme to each paragraph. Now that might be, you've got two sets of principles you can follow. That might be that you might paragraph according to priority. So it might be primary issues, secondary related issues, and other details. Or you might think it makes more sense to present the information in some kind of a timeline in chronological order. So it might be first consultation, second consultation, and then other details, or it might be, or it might be admission, during care, during hospitalization, point of discharge. So it really is built into the test. You need to make these decisions in terms of, if I was receiving the letter, what would be the most logical way to present that information to me in order to get a very clear understanding and sense of what is going on with your patient. So 5 minutes of reading time. So in the 5 minutes of reading time, you need to do the following. I'm putting up 4 questions, okay? We do this every single week because this is so fundamental to getting the understanding and the direction of what you're writing, the purpose, correct, okay? So those are the 4 key questions that you're always going to ask yourself, which will focus you on what we call the purpose, which needs to be clearly expressed in your introduction. Okay, so I've got a question from Rosalie. Could you please explain the difference between main and secondary issues when you're talking about the patient's problems or diagnosis? Yes. So if, say, for example, you had an elderly lady who'd had a fall and she came in with a suspected fracture into the hospital, okay? But you also noticed some other, she's also got some other maybe pre-existing conditions like the beginning of dementia, okay? Possible dementia, something like that, or some memory issues, that kind of thing. And also she might have some pre-existing issue with her eyesight. If you are writing to a home care nurse to oversee the care of this lady who lives alone and has some mobility issues, that was the main reason that she came into hospital, okay? So the priority would be to write about everything connected to any injury she may have sustained from her fall. But in the secondary issues, you're thinking, well, the home care nurse is going to be going to the patient's home, you know, on several times a week to basically support her with mobility issues as a result of this fall. But they also need to be made aware of things like eyesight problems, maybe if she's got some memory issues, some medications, that kind of thing. So you need to think about the person you're writing to, what you're asking them to do, and other comorbidities or pre-existing conditions that they might also need to know about in order to successfully look after the patient. Okay. So Sadira is saying, I always find it difficult to write about purpose. Okay. All right. So it's about the salutations. It's about the greetings. Okay. Got that, May. Yeah, absolutely. So I haven't read it, but basically there isn't just one way to write the introduction. That is not the focus of the letter today. But we can talk a little bit about that towards the back end of the live class, because I want to stay focused now for the majority of students on writing the purpose. Okay, so that's what we're talking about right now. So to write the introduction is going to contain the purpose. All that means is if you are receiving the letter, you would want to immediately, okay, you've got the RE line and you've got the patient's name and you've got the date. If you've never met the patient before, you need to know what is the primary issue here with the patient and what is it that this person is requesting me to do. So that needs to be very, very clear. The other thing that you might want to include is if you are discharging, for example, to a GP, you might want to make it clear that you understand that the GP will already have background information on this patient. So you might want to make it explicit in the purpose. And that might be the reason why certain things might be left out, because you're assuming that the doctor will have the patient's medical history. We're going to look at an example. It always becomes a bit clearer with an actual example. But these are the 4 questions to determine purpose, okay? So you have to imagine, if I were this person and this patient was coming with this particular problem, what would I need to know? So the introduction is very short, it's very brief. The detail, the expansion on the purpose will come in the following paragraphs. So that's the task. Now we're going to look at reading the case notes to determine what is relevant, repeated, and not relevant. So I'd like to put relevant and repeated in the same bracket, okay? All we mean by repeated is just because something is mentioned more than one time in the case notes, that doesn't mean to say you need to mention it twice in the letter. The most important factor is it relevant or not? If it's irrelevant, forget about it. If it's relevant and it's mentioned more than once, that means include it, of course, but think about where the best place to put it in your letter is. So ostensibly, it's either relevant or not relevant, okay? But some of the relevant information may be mentioned more than once. That's all we mean by that. So here is an example of a task. I want you to read it carefully, and I'd like you please to answer all 4 questions and just type them into the chat box. Just briefly type in the answers to these, which will be the basis of your purpose. Okay, so let's pop those answers up on the screen. Okay, some of you have put yours into the chat box. Let's just pop the answers up. So who am I writing to? The patient's GP, Dr. Martins. So that means that there would normally be some kind of assumption that they would have some medical history on this patient if it is their own patient. So what action do I want the reader to take to review the patient and provide ongoing care? What does the reader need to know? In other words, the GP, they need to know the patient's current situation or current condition. So we need to bring them up to date on the most recent events that they will not be aware of. What does the reader already know? They have prior knowledge of the patient, but be careful, okay? So just read the case notes very, very carefully and in detail. So I'm going to put some case notes up on the screen now. And you're going to get the 5 minutes or maybe just a little bit less to go through, read very, very carefully to decide what's relevant. If anything's in more than one place, just be aware of that, okay? And what the third category, what is clearly not relevant to the doctor, to the GP, and can be confidently left out. So just to refer you to the assessment criteria under content, okay, so this is connected. If you want to score well under content, this is one of the areas you will be definitely assessed on. You need to make sure that all key information, the detail, is included in terms of the patient's medical condition. So anything which is key to the patient's condition must be included. So when you're updating the doctor on something that's going on with the patient that they will not be aware of, all important details must be in the letter. Conciseness, so on the other side of that, okay, you need to get that balance between what needs to be included and what needs to be left out. No irrelevant information must be included. In other words, do not waste the time of the GP with anything that they do not need to know. So you need to have a letter which is clear, concise, efficient. You are a healthcare professional conveying important facts to another healthcare professional. So the idea is that you need to include what they need, but definitely don't waste their time with what they do not need. Okay, so I'm going to put the case notes up now, give you some time to read through them very carefully. Okay, here we go. Okay, I'm back. So I'm going to do some highlighting now on the screen. And if you have any questions or you think there are any discrepancies, just let me know. So let's do some highlighting. So in red, we've got the relevant stuff, and then also relevant is in blue. It just might be mentioned more than one time. So everything that's highlighted in blue or red on the screen is some information that we need to include in our letter. So let's have a quick look. So basically, this basically happened following a fire at his residence. Okay, so it was a fire at his home. The name of the patient is Robert Smithson. He's 22 years old. He was admitted to hospital on the 6th of April. And basically, provisional discharge date 4 days later, pending the consultant's report. Then we have his admission details, relevant. Okay, the sprained ankle and the flatmates, that's not relevant, okay, but all of the details surrounding his symptoms when he was admitted, that should be included. Now, we're assuming in the medical history section that these previous ailments basically are on the medical records with the GP, so we don't need to include those. Social background, he lives in shared accommodation, that might be worth mentioning. And then the nursing management and progress, these were the things that were done for the patient when he came into hospital, okay? And then basically we've also got the elevation of head and torso down there. So then the medications that Robert Smithson was put on for the condition, for the burns, are all here. So we might want to let the doctor know that these are the medications that the patient is currently using. And then assessment on the 9th, okay? So basically, the patient was stable and breathing normally, and there was no infection, no fever, and all the bloods were normal. So at that point on the 9th, okay, 3 days after admission, they were just waiting for the consultant's report to discharge the patient. So in the discharge plan, there's a lot of information in here. Now, some of it will be for the GP and some of it will be directed towards the patient themselves in terms of self-management. So things like daily auscultation for 2 weeks, that will be something that the GP can do. But then the patient was given instructions on how to apply high factor sunscreen. So that's something that the patient will take responsibility for. So you need to sift through the discharge plan. So what's for the GP and what is for the patient themselves. Okay, so that's basically a sort of selection, okay, in terms of what is relevant. Okay, so now we're going to move on. I'm just checking the chat box to see if we have any questions with regard to that. Why in management few things are selected? Okay, because if it is normal, okay, these are kind of, so the patient was monitored for stridor, which is that high-pitched wheezing, hoarseness, coughing, but it says nil. It didn't exist. So if they were monitored for it, but there wasn't any, so it's nothing that we need to inform the doctor about. And the hourly monitoring urinary output, that's pretty standard stuff. I don't think we need to, that's not going to help the doctor in any way to perform the actions that have been requested. So just think about what's necessary. If you were the GP, what would you need to know? Of course, these are standard things that are done, but if everything is completely normal, those are standard procedures that you will go through in the hospital, which the doctor would know about anyway. Okay, so I hope that is clear. Okay. So the chest X-ray was clear. So we've just selected things that we think need to be the doctor needs to be aware of. The blood's full blood count, type and cross match, serum glucose. That was all within normal range. So they would need to know the test results, but they wouldn't need to know that you did some monitoring of them in hospital, because that would be assumed. So you would include those things. You can say fiber optic laryngoscopy or intubation was unnecessary. If that had been done, then I guess that would have some kind of repercussions, and the chest X-ray was clear. So they're just sort of letting the doctor know that at point of discharge, this was the condition of the patient, okay? Yeah. Okay, so yes, basically you have to, let me paraphrase that last comment in the chat box. You have to imagine, if I was the doctor, what would I need to know and what would be unnecessary for me to know in order to carry out the requested actions. So always put yourself in the shoes of that person. Imagine you are that person. What do you need to know? What would be helpful? And what is clearly unnecessary? So just a quick note here, OET requires you to be flexible. There is no template, okay, that you can lay down on a letter, just as there is no template that you can lay down on an individual patient. When a patient comes into your care, you need to look at the full picture and you need to make decisions based on that individual patient. So you can't just sort of put a cookie cutter sort of template down on patients, and likewise, you wouldn't be able to do that in the letter. So you always need to be guided by the purpose, okay, which are the 4 questions that came up earlier, in order to guide the information that you will be conveying to the recipient of the letter. Yes, but you would like to know what has been done for the patient, but think about if you were the doctor, you would. There are things like monitoring them hourly that you basically would assume, that's an assumption that is obviously going to be happening when someone's gone in with those serious burns. But you have to think about the doctor, what is going to be helpful for them to do the action that has been requested. So I'm always going to put it into that context. So you are going to be writing the secondary issue paragraph. So all that means is that you need to think about, what would I put at the top of my letter as being the most important? What would be in my second position of importance in the letter, and then what would be in my other details paragraph, and then my request paragraph. So think about it like that. I just want to briefly put up on the screen the format. Before you get into the writing section, I'm going to ask you to do a little bit of writing today. So for the purposes of OET, you need to format your letter pretty much like this, okay? The reason for that is we standardize, or they standardize the format to look like this, because ostensibly they want all of the letters coming in on test day pretty much laid out the same way, because really the bit that we're judging for the most part, although you do need to get the format correct, will be what you're writing between the greeting and the signing off, okay? So these are the elements, if you like, that you need to include. So you need to include the title and the full name of the person you're writing to, and you will usually get that from the task. You need to put their job underneath, their position, okay? So that also will come from the task normally. And then the address that you are writing to, okay? So that goes as a chunk of information into the top of your letter. You also need to include the date, okay? So the date will be made clear in the letter, but also on test day, you will always be putting the actual test date. So it's just, keep it simple, don't overthink it. Just put the date that you are writing the letter in this position here. And on test day, it will be the date of the test itself. That's it. You don't need to think about it any more than that. For the RE line, this means with reference to, so at the top of your letter, you need to be clear on the patient's name and their title. So you're going to put the full name and the title of the patient. In this case, it's Mr. Robert Smithson. And you also need to put the age of the patient. Now, sometimes they'll give it to you as the date of birth. that's fine. It's either the date of birth or the age, either are absolutely fine. However they present it in the case notes is how you will put it in the RE line. Then you're going to use your greeting. So you will notice that you're writing to Dr. Martins. So now we can drop the first name of the person you're writing to. Dear Dr. Martins, comma, signing off, yours sincerely, comma, and then you are the ward nurse. So you're going to write it like that. So two kind of variations on the format. The RE line can go above the greeting or it can go below the greeting. The date can go after the name and address or it can go above the name and address. It really doesn't matter. But those are the elements that you need to include. So I'm being asked by Robert, should you write 22 years old or aged 22? Both of those, Robert, are absolutely fine. Okay? All right? Both of those are absolutely fine. You will see basically these live classes for OET, they go on a cycle of 10 weeks. Okay, so you will see different ways of writing the age, but both of those are absolutely fine. So please expose yourself to all the different sets of case notes and look at all the different ways that we have incorporated the formatting. So basically expose yourself to all of them. You'll get to see different sets of case notes. You'll have different purposes, different focuses, different assessment criteria, and each one will give you the format. On top of that, you can also look at how to do the formatting of the letter. That is a section on the E2 language student page. So you click on OET course, and then you'll get writing will come up, and you'll get all of those different aspects of writing to prepare you with practice materials. And under one of those, it says formatting of the letter. So that is in the platform as well. So getting on to the job in hand, which is the important part of this class, between the greeting and the signing off, that section should be adhering to the guideline of 180 to 200 words. Now, you will not get penalized if you go a few words over this limit, but the way the test is designed is for you to be able to write within this guideline. If you've gone way over the guideline, the examiner is going to first of all think, either maybe you've included irrelevant information, or it might be that you are writing unnecessarily long, convoluted sentences or writing a sentence per case note instead of combining information to be more efficient with language. So that's something we deal with in one of the live classes. So that is basically a guide to the number of words you want to be writing, but also the style of how you need to be writing. Clear, concise, okay, and efficient. Those would be descriptors I would use for the style of how you want to be conveying information to the person you are writing to. Okay, thank you for that comment, Anna. Okay, so basically, yeah, I mean, basically we rotate the focus in the live classes. Sometimes we're writing the purpose and the request, sometimes we're writing the primary issue, sometimes the secondary issue, and sometimes the other details. They are all aspects. I couldn't do all of it in one live class, so we kind of vary the focus, and today it's going to be the secondary issue. So decide how many paragraphs and what will go into each paragraph. Introduction, okay, top priority, okay, paragraph. Second priority paragraph, other details, for example, or if you're doing a timeline, it might be admission, care in hospital, discharge, however you've decided to paragraph. There isn't a fixed way of doing it. You need to make a logical decision, okay, about showing the examiner that you know that a paragraph needs to have a focus rather than just writing everything as one long piece of prose. You need to break it down into logical, single-themed paragraphs. So what is the additional information? So aside from the burns, what is the additional information we should include here in the letter? So if we put the notes up again, I'm going to do the pre-selection for you. So say, for example, this is information that you've decided, I'm going to put this information in my secondary paragraph. Okay, so there's basically provisional discharge date, okay, pending the consultant's report. And then this is stuff that in the discharge plan that has been discussed with the patient, things that they need to do. So in other words, it's not going to go into the request paragraph. That is for the GP. This is stuff that the patient needs to follow up with to take care of themselves at home. So we're going to put this into our secondary issue paragraph. And I'm also going to put on the screen some useful language to sort of connect your bits of information to provide a nice streamlined and cohesive paragraph. So try to incorporate some of that language with those notes, and I'm going to give you about 5 minutes to write your own version of the paragraph. I'm just going to change the chat box settings so that for the time being you don't get distracted by other people if you choose to type it into the chat box. John, okay, before you do it, John's question. I have a question. Basically, when writing a letter, we just copy relevant information and make it into a paragraph. There's a little bit more going on there, John, than that. When you say copy it, yes, you don't need to paraphrase the vocabulary, because if you paraphrase the actual vocabulary in the notes, if you kept paraphrasing it, you'd probably demedicalize it. So the actual vocabulary is fine, but you need to think about how to expand the notes into actual sentences, and think about what you would combine as well into one sentence, because you want to be concise and efficient. So you're not going to just say in this order of the case notes, writing a very mechanical, I'm going to do a sentence on this, a sentence on this line, a sentence on this. No, you need to think a little bit more about what's going to head up my paragraph. What bits of information could I combine together that belong together in a sentence? So there's a little bit more thought that goes into it, and we have provided some useful language for that cohesion, what we call linking, okay, connecting, streamlining. So there's a bit more style going into it than just a sentence per case note. I'll point out the features on the back end of this exercise. Hi guys, sorry, I'm going to cut you a little bit short because the time just goes so quickly in these live classes. Okay, so I'm conscious of the time. So I'm going to put an example up on the screen. Okay, I'm going to point out some language features. So just to show you that this information it's quite a dense paragraph, but it's been broken down into 4 sentences ostensibly. So let's have a look at what's on the screen here. So we've got pending the consultant's report, comma, Mr. Smithson will be discharged on this date. So that's the first, taken care of the first bit of information. So basically, he has been advised to apply a high factor sunscreen and to moisturize and massage the affected area. So the things that he's been asked to do, that's been combined into one sentence. And as you can see here, we're using the present perfect passive, okay? He has been advised to apply, moisturize, and massage, okay? So those are the 3 things combined into one sentence. Then it's making a recommendation. He should, so that is obligation, making a recommendation, follow a high protein diet and maintain fluid intake. So putting the diet and the liquids together in one sentence. That makes sense. It is also important, so we've got different ways of introducing these sentences so we're not being repetitive, that he performed deep breathing exercises, so we're highlighting this, for lung expansion and to allow secretions to drain. So we're heading up with it's important to do those 2 things, and then the purpose of that is to allow the secretions to drain. So that's a nice sentence combining that. And then the final sentence, he has been instructed to refrain from contact sports, okay, or to stop contact sports and vigorous activity for a period of 8 months. So it's dealt with in a very logical order, okay. It's been introduced in a good way, information has been combined, and it's all basically the recommendations, but using different language, so avoiding repetition. So it's a good example of how to make recommendations, advice basically to the patient using different language. He has been advised, he should follow. It is also important that he do something, and he has been instructed. So look at those 4 different ways to give advice. Very, very useful language indeed. Pending means awaiting, okay? If something is pending, the test results are pending, they are not ready yet. You're waiting for them, pending. Okay, useful bit of language there. So I'm going to put the whole letter up on the screen now for you to take a screenshot, guys, okay? So please do take a screenshot because I will be moving on. I've got just one more thing to do in the live class after this. So let's have a look at how the letter, how we've dealt with it in its entirety. So the purpose, remember those questions we asked at the beginning, your patient, we're making it clear that we know the GP knows the patient, okay? So that is made explicit. Your patient, Mr. Smithson, was admitted to our burns unit following a fire at his residence. So we're just touching on the issue. We're not putting any detail in, that comes later. So he's been admitted for burns. Your ongoing care of his injuries is appreciated. So we're not specifying, that will come down here in the request paragraph, the things that we want the exactly the GP to do. We are just basically, when he reads this, or it's Andrew Martins, it's a gentleman. So when he reads the initial introduction, he'll say, what's going on with my patient, Robert Smithson? Oh my goodness, he was in a fire, he's got burns, and I need to take care of his ongoing needs, basically following his injuries. There are things I need to do. Very, very clear. Then the first paragraph is basically expanding and providing all the detail on his admission and the burn situation that he experienced. So you're saying how much of his body was covered, respiratory distress, no necessary intubation, but there was a lot of soot in his oral cavity. Chest x-ray was clear, blood test normal, burns are healing well and no sign of infection. And then he was given the relevant pain medication. So they've kind of summarized that. So the patient will be basically self-medicating on those medications. That's not something that the doctor will need to get involved with. Pending the consultant's report, this is the secondary stuff that in order to recover from these burns, this is what the patient needs to be doing. So he's making the doctor aware of these are the things that the patient is doing. And then in the request paragraph, they want specifically the doctor to kindly monitor his progress to make sure everything's proceeding okay. To see to his wound dressings, that's something the GP will need to take care of. And they said daily auscultation, so checking his breathing every day for the next 2 weeks. So the patient needs to go to their doctor and they need to be doing very close monitoring, follow-up monitoring of this patient. Also informing the GP that there is a follow-up appointment at the outpatients unit. So making the GP aware of that with the date that it is set for. Okay, and that basically is dealing with all of the information in the case notes in logical. You're normally writing, excuse me, at the point of discharge. So if you looked at the case notes, it said that the patient's ready, basically in a good state for discharge. All they are waiting for is the consultant's report. As soon as they get that, so it was being written on the 9th and the due date for the discharge is the 10th. So this is being written after the admission, after the treatment, when the patient is deemed ready for discharge, but they just need the consultant to sign off, okay, with the consultant's report before they can actually officially discharge the patient. So they're just passing on all of this information to the patient's GP. So under language, okay, we have a question coming up here. To reduce, not included, but the purpose for lung expansion to allow secretions is included. Yeah, okay, if you feel that is another detail that would be helpful to the doctor, by all means include it, okay? Ultimately, your medical knowledge is always going to be superior to mine. So use your judgment, guys. You are the professionals. You know what the doctor needs to know. This is a medical English test. It's ostensibly for your language, but you need to bring your medical knowledge to bear in order to put yourself in the shoes of the GP and think about, if I was in this situation in real life, what would I need to include? What would be helpful for the doctor to know? Okay, so that is why you choose OET and not IELTS, because basically it's in a medical context where you can apply your expertise and knowledge to the situation to decide what is going to be relevant and helpful to the recipient of your letter. So, very briefly, because we've kind of gone a little bit over time, punctuation is something that I know some students struggle with. So, the three main areas of punctuation will be full stops, commas, and apostrophes. So let's look at when we use a full stop. So at the end of a sentence, that's number one, to denote the end of a sentence, and we don't want to be writing really long convoluted sentences, so normally keep them to maximum a couple of clauses. And then full stops are also used after some abbreviations, for example, i.e., e.g., and etc. Then we have commas. First use is to show a pause in a sentence. So finally, or you can say during hospitalization, comma, okay, pause, and then you go on to give your information. So finally, comma, we should write a letter to the chairman of the board. Second use of commas, when we are listing, maybe you're listing medications, you can say the patient is currently on the following medications. It might be Lipitor, comma, isinipril, comma, gabapentin, and the final one. I'm just making up medications on the spot there. Okay, so say if you were listing things, okay, rigidity in the shoulders, comma, forearms, comma, neck, and back. So for the last thing in the list, you would use and there would be no comma before and when you are listing. They're also used around relative clauses, which are fairly commonly used in the introduction, in the purpose at the beginning. So this is when you want to insert additional information into a sentence. So you might say, I am referring Mr. Jones, comma, who has ongoing difficulties with mobility, comma, for further testing and evaluation. So the commas are kind of acting like brackets when you're inserting additional information, and it's called a non-defining relative clause. If you want to look that up on the E2 School website, it's a very useful thing to be able to use in your letter. It's for inserting additional information. Then we have apostrophes. Apostrophes are used for ownership of something. So, for example, these are Mr. Davidson's test results. His name is Mr. Davidson, apostrophe S. They are the test results of Mr. Davidson. So it's more natural to use possession, apostrophe S. So that's for a singular possession. It's one person, so the apostrophe would go between the N and the S. But if you want to use it with a plural subject, I'm looking for the, or plural object, okay, plurals in general, I'm looking for the nurses' timesheets. So you can see it's nurses in plural. So if the timesheets of the nurses, not just one nurse, then you would put the apostrophe after the S for a plural situation, okay? So those are some examples of punctuation, the main ones that you need to use, and obviously capitalization at the beginning of sentences and for the names of people and also the names sometimes of brand medications, but not for conditions. Except for Alzheimer's and Parkinson's, okay? So when you're capitalizing conditions, cancer, hypertension, diabetes, small letters, but there are a couple of conditions which are named after actual people, like Alzheimer's or Parkinson's, and those take capital letters. They are proper nouns. So 3 sentences on the screen. Which one, guys, is the correctly punctuated sentence? Maybe just have a quick look and type in the number into the chat box. Okay, well done. Okay, we've got a few people typing in the number 3. Okay, I'm going to just change the settings back to all panelists so you can see each other's comments and communicate. Okay, cool. So, yeah, you're right, absolutely. Okay, we're going to highlight that. That is the one that is correctly punctuated. Okay, so a little bit of a quiz here. Have a go at dealing with the punctuation in the blue box. You need to add any necessary punctuation, full stops, commas, and apostrophes, and capital letters. So I'm just going to give you a minute or so to have a go at doing that yourselves. Highlight on the screen, just this is what it should look like. Okay, so have a look on the screen, look at where it's been capitalized, where the full stops naturally fall in terms of where you're going to break it down into sentences. Yeah, okay, so Mr. Brown was diagnosed with NIDDM in 1999 and has been monitoring his BP and sugar levels at home since then. Great, okay. He has a strong family history of diabetes and is allergic to penicillin. His weight is steady and an eye examination in October 2017 indicated no issues. So also look at the tenses in there. Was diagnosed, okay, because you've got the date, so it's a past simple passive. Has been monitoring, present perfect continuous since then, so it is also ongoing. So since that time up till now and ongoing. He has, present simple, fact, a strong family history of diabetes and is, fact, allergic to penicillin. His weight is steady, okay, that is a fact, and an eye examination in October 2017 indicated no issues, indicated in the past simple, completed action in the past at a specific time. So it's also a very good example of how to use tenses. Okay. Would it be okay if there's no comma after BMI 24? Yeah, I think that's what we call the Oxford comma. If it's not there, it's basically it's a relative. I'm very old, okay, so I wouldn't have, the way I was taught grammar, I probably wouldn't put a comma there, but it is something that you can put if there's a slight switch in focus there. You can use, I think it's called the Oxford comma. You can go without it, and that would not penalize you in any way. Okay, you can just do a run-on and an eye examination in 2017. There is a switch, yeah, there is a switch in focus, so I would say that particular comma is optional. All right, but you do need those commas, you know, like when you're signposting the beginning of a sentence, like finally, comma, and then you continue on with your sentence, or on admission, comma, or you know, on the 27th of June, comma, Mr. Jones presented with. Okay, so in those situations, you do need to put the comma. Best of luck with your preparation. Okay, guys, take care and see you very soon. Okay, have a fantastic week. Stay safe, guys. Yeah, good luck with your preparation.